Hello, everyone. This is Brian Zimmerman with Becker's Healthcare. Thank you for joining us for today's discussion on dental service organizations' revenue playbook. Rising costs and delays in payment are reshaping the dental landscape, but there is good news. DSOs with strategic revenue practices are finding ways to thrive. Today, our panel will explore the tactics that can help protect your organization's profitability. Before we get into that conversation, I'm going to cover a few quick housekeeping notes. If you have any questions for our speakers throughout the webinar, please feel free to type them into the Q&A box you see on your screen. We can follow up with you and get you an answer. But there will be a Q&A session towards the end as well, so we'll take some questions there. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have issues with audio or visuals, just try refreshing your browser first. You can also submit any technical questions into the Q&A box. We've got folks on the back end who can help you out with that. So with that, let's have our speakers introduce themselves. I'm going to tap on each of them to give some background, some details about their work, and share one trend you've noticed that's impacting DSO revenues. James, let's begin with you.
Yeah, thanks. James Swan, Senior Director of Enterprise with Rectangle Health. I've been working in healthcare for the last 10 years, been with Rectangle the last 5, and I've had the opportunity to work with a number of scaled DSOs kind of from inception all the way through some of the largest organizations. And really the one trend that I think is presenting itself more and more common is really chasing down those that outstanding AR post-adjudication from those insurance claims. So I'm excited to talk about that topic today and get to hear from a couple others in the space and their thoughts on it as well.
Excellent. Thank you for being here, James. Elizabeth, let's meet you.
Yeah, thank you. It's Elizabeth Davis. I'm the VP of Revenue and Payer Relations at Pepperpoint Partnerships. I've been in the healthcare RCM field for about 18 years. If I had to say one thing that I think is really challenging now, let's say just claims management on the payer side and just tracking down those claims and getting those denials answered and sent back out in a timely manner or corrected. And that really comes from just sharing data from both the payer side and then the vendors that we use, including our PMS or Rectangle, AirPay, and the other ones, just getting access to the data.
Absolutely. I'm sure that resonates with many folks dialed in today. Thank you, Elizabeth. Derek, go ahead.
Yeah, hi. Thank you for having me. I'm Derek Giddin. I'm actually a dentist. I practiced for about 10 years in Brooklyn and went on to start AirPay. We're a dental software company based in New York City, and we provide automation for dental front desk teams and back office. One trend that we see, we were fortunate to work with lots of groups across the country of all different shapes and sizes, and everybody's complaining about employee turnover, or I wouldn't say complaining, but struggling with employee turnover. It's tough to find good folks. It's tough to keep good folks. It's tough to train folks when you do find them, and then to keep them. And so that obviously has a bunch of impacts across the board in running a practice, and something that I dealt with when I was practicing as well.
Derek, and let's dig in a little bit deeper here, and talk about sort of some of the significant challenges you each sort of outlaid different challenges that DSOs are seeing. I'm wondering if we can expand on them a bit more. What are these challenges that really significantly influence profitability, and how are they impacting cash flow specifically? Elizabeth, maybe you can get us going here, expand upon what you shared earlier, or share something new.
Yeah, I think for me here, it's probably just the labor side of things and staffing. We always say at Pepperpoint, we need the right people in the right seat. So finding people that have the knowledge or the capability to do the job is always challenging in this climate right now. But I do believe that the use of AI makes it a little bit easier. Tools like Rectangle or AirPay, they make it easier to train people faster, and they don't have to have, 10 or 15 years worth of knowledge. We can teach them with new tools that are available how to do the job in a faster time frame. So the training time definitely goes down. And I would say from what I said earlier about the denials, I just feel like we're able to identify denials quicker now and get those resubmitted or push that to the patient's AR portion when we have it sitting in our insurance AR. So having tools at our fingertips available sure does make that a lot easier, and we can train our staff faster.
It sounds like some significant challenges, but finding ways around it,
Sure, of course.
giving teams the support they need to thrive. Derek, what would you share here in terms of challenges folks are facing out there, profitability? You flagged labor as well. What would you expand upon?
Yeah, I'd say obviously, or maybe not obviously, but AirPay is mainly known for automating insurance verification. And so we have a lot of insight into that struggle and challenge in dental practices and DSOs. Insurance companies don't make it easy. There's a lot of cost, time, and drama kind of on the front end before you see a patient in validating their insurance and kind of figuring out what they're expected to owe for their visit. And then there's also a lot of cost, drama, and time on the back end in submitting claims, appealing claims, and kind of chasing down claims and payments. Patients obviously are impacted by this, and it's a really tough situation for practices to be in. Again, we can really sympathize. On one hand, you have a patient that's just as frustrated as the folks in the office in terms of not getting kind of clarity about their visit. And the practices are in this tough position because the patients are not communicating with the insurance company. They're most often communicating with the person sitting at the front desk that obviously, is kind of just doesn't work for the insurance company, but is kind of taking the brunt of any patient dissatisfaction. So it's definitely a tough position to be in, and it impacts, again, everybody involved. But like Elizabeth said, there are tools out there that make this a little bit easier. And there's definitely, I'd say, a shift even on the payer side to kind of like make this easier for everybody in the ecosystem and just improve things across the board. Yeah,
and interesting too, those folks at the front desk, they're sort of caught in the middle, right? They've got to understand what is going on the payer side of things, and they're kind of responsible, I guess, for the patient education component of it too. Am I reading that right, Derek? Like they've got to help the patient along and help them understand and speak to their frustrations. That's a challenging position to be in.
Yep, they have to, access all this information and then explain it to the patients. If the patients don't like what they hear, that they're then kind of having to smooth that out. Obviously, it's not their, they don't design the plans or anything like that. But they're explaining what a deductible is probably 100 times a day to their patients.
Yeah, excellent. James, what would you add here based on what you've heard from Derek and Elizabeth?
Yeah, so I think on Derek, more what you said, exceptional dental services and support within the practice was enough to maintain customer loyalty and whatnot. But now it's really this holistic idea of kind of pre-care, point of care, and post-care exposure and experience that we're providing. And each level of that experience is going to be incredibly valuable. And when we think about kind of the collection of the revenue side and with higher out-of-pocket costs than maybe ever before, we need to be thoughtful of each of those different touch points, again, pre, point, and post. And we think about how it impacts profitability. It starts with having an accurate estimation when they come in, being able to collect on those, whether it be copays or expected charges at point of care in a seamless way, ideally while capturing something like a card on file with pre-authorization to bill that card for services provided. And then obviously billing to the insurance, getting post-adjudicated balance back in a perfect sense. If that goes as easily as possible, we then have faster access to info and can ultimately go in and collect on any of those post-adjudicated balances that are patient responsibility. And the faster we can speed that process up, the more likely we are to not only catch that patient when they're still thinking about and had a positive experience with our dental staff, but we're also able to more effectively and efficiently collect on those outstanding funds to close the loop on that overall transaction. So it's really this big picture workflow that we need to make sure we're being super tight around from each perspective, pre, point, and again, post-care.
Appreciate you laying that out. I think now Elizabeth, Derek, you flagged and James flagged some of the tools here that can be used to navigate some of these challenges. Elizabeth, I want to come to you again. What are some of these tactics tools, if you can expand on that, DSOs are using to address delayed reimbursement specifically? Can you expand on that for us?
Yeah, so we have a tech stack that we've adopted here at Pepperpoint. We use AirPay, Rectangle, and we also use a claims management tool inside Desk. So we're using those tools in all of our offices to try to mainstream, our admin staff and really get the right people in the right seats and the tools in their hands so that we can really scale our admin team, right? I mean, we're looking to, for one, make the patient experience better, like James alluded to. I mean, we want our patients to get great insurance verification breakdown and know what their bills are going to be coming into the treatment plan that they've accepted, so we don't have any surprise billing. I recently was reading an article actually on Becker's that was stating that patients will most likely leave a dental experience not because of the care they receive from the dentist, but because of a poor RCM experience. So a surprise bill or not knowing what to expect or having treatment done and it costing significantly more. So we're trying to get the tools in our staff's hands that will really give them the tools to make the patient experience great. And on the other side of that, we're looking for our outcome to be better on our revenue, right? Driving the revenue more, getting the patient's portion up front. Again, like James said, collecting that. If we have a great insurance verification or breakdown, we'll be able to collect that patient portion while they're right in front of us rather than sending a statement months later and really delaying our day sale outstanding.
And do you feel like Elizabeth, and by the way, everyone, I did not put Elizabeth up to referencing Becker. She did that all on her own. But do you feel like this also sort of allows for more treatment adherence, more folks to continue to come in and continue to fulfill if the financial education happens on the front end? Are they then able to sort of keep coming? Yeah.
Right. I think really that's what they're looking for, right? Dentistry work, treatment plans can be expensive. The patient just wants full transparency, and they've really developed an intolerance for the admin staff or the front office staff at a dental office not being able to give great information. Unfortunately, a lot of it actually relies on the payer, right? And like I was saying earlier, getting access to data, good data, so you can care for the patient is really challenging in today's world. I mean, we're looking for access to good breakdowns, and we have to spend an abundance of time, or folks like AirPay, have to go out and chase the payers and get them to provide the information needed to just give the patient the information they deserve, right? To have a great experience in the office. So I think that's key, and that's really what keeps patients coming back is just the full transparency that the offices can give. And it really starts with the insurance verification.
Thank you, Derek. Going to you now. I think kind of have to after the payer chasing comment, but I'll move to you now. Can you expand on sort of the tools that you mentioned as well that folks can use, sort of build on Elizabeth's comments?
Yeah, sure. Well, we're happy to chase the payers, Elizabeth, for you and for anyone else. Yeah, we're seeing lots of different tools. I think, when I was practicing and then started a software company. There were only a handful of dental software companies kind of out there 5 years ago or whatever, but there's many more now. And so there's lots of innovation, and everyone's kind of focused on a certain piece of the revenue cycle. There's tools out there, again, for verification, for claim statusing, payment posting, lockbox. There's lots of different kind of functions within the revenue cycle, and lots of great tools that are out there for each of them. But I think just, again, at a high level, we're really excited by just how much attention there is in the space. Again, no one was even thinking about any of this stuff. I mean, I guess Elizabeth, you were probably thinking about it, but there was far less innovation, 5 years ago, certainly 10 years ago in the space. And then, just again, like if you look at reviews of a dental office online, lots of those reviews, if you're looking at negative reviews, are not about my crown is too high or whatever and I can't chew. It's, you know, they sent me a bill, no one told me about it, you know, lots of that kind of chatter. So it's very important. I mean, from a patient's perspective, you know, you can go online and find the price of anything and shop and compare and read reviews. But again, the kind of experience of going to a dental practice and understanding what you're going to pay is still extremely frustrating. And patients' expectations and kind of like their consumer expectations have changed in the past 5 or 10 years. And I think a lot of that innovation is a product of that.
Yeah, and to your point, patients are likely, they're not segmenting in their head the clinical care they get from the financial experience they have. It's all for them. It's all one sort of lumped in together experience, right, Derek?
Sure, for 100%. Yeah.
Yeah. James, coming to you now, what would you build on here in terms of tools that DSOs are really, really having success with? As Derek mentioned, sort of a very innovative space right now, a lot of options, but what would you flag?
Yeah, I think one thing that I couldn't align more with that Derek stated is 5 years ago, there were not a ton of technologies out there competing to solve a lot of these challenges. And today there are more technologies than ever before. And I think that's great because we're seeing that there's a specificity around solving these healthcare specific challenges. So when we think about kind of Rectangle's position in all this is we've always kind of tried to meet our clients and prospects where they're at. And what I mean by that is throughout every single iteration, there always seems to be something different, whether it's point of care collections with things like recurrent or card on file. When we think about post care collections with things like bulk text to pay. Obviously, when COVID first hit, any ability to text our patients and collect on those funds was a critical impact piece. But really before that, it wasn't seen as something that was a necessity. So when we think about now in today's 2025 kind of RCM ecosystem, everything's about speed information, speed to capture and gather what we need to do to make and act against it. And one of the things that we've rolled out within the last year and a half is this idea of straight through processing. So when we are going through the claims process and the payer's paying, how do we ingest those funds as quickly as possible to not only be able to have faster access to cash, but also then be able to act against that information to communicate with the patient if there is an error or additional outstanding balances, things like that. So again, I think it's all speed to react to provide that exceptional experience with patient to ultimately, again, close the loop on that transaction from start to finish.
A really good way to think about it, speed as being essential here, especially in this time frame, and appreciate the points too, James, about how COVID sort of accelerated and changed a lot of the space. Do you think that's fair?
Yeah, without question. And I think it finally somewhat leveled the playing field between other experiences like retail and elsewhere that people now expected healthcare to catch up. And maybe that's not a fair assessment that healthcare was behind, but I think that there are definitely opportunities to find some of those optionality points for patients to be more like a retail experience or similar.
For sure. And the stakes are kind of higher too. Like, and so it's natural that your dental health is a little bit more high stakes than what you might watch on Netflix on a given day, but they want that personalized experience. It's no wonder they want it for dental care as well, right?
Absolutely.
Yeah. Wondering here if we can anchor the conversation for folks watching with some specific examples here. So I'm going to tap on each of you to share a specific example of how automation or technology has improved cash flow for a DSO. I think we've gotten some high level commentary on this, but would love to zero in and get some specifics. But Elizabeth, I'll tap on you to go first.
Yeah, of course. As I mentioned earlier, this is kind of twofold for me. The rising cost of labor and the ability to really find people that are skilled in the revenue cycle has been challenging, to say the least. So I think there are really big savings in using automation and finding people, that have less experience. For one, they they're not as expensive, right? But we can also train them faster, and we can really scale our teams to be a little bit smaller using the technology. I'd also say using tools like Rectangle for the James just mentioned their bulk text to pay. So we can send a bulk text out to everyone that has a balance, right? And we've really seen significant growth in collecting that patient AR with very little time. We load it into their system, it sends it out, and then we just see the cash flow start to come in. And we've really not had to have people on the phone chasing patients. Patients are really more likely, if you send them the text, to pay you. And if we've got their card vaulted, with a few couple of clicks on their iPhone, they've now paid their bill, and we've extended very little labor in doing so. So I think both of those things combined together, using the automation along with really scaling our labor, has been significant to increase the cash flow for the partners that we serve and the practices that they have.
And I think it's intuitive too, as consumers, we think about how much more likely we are to pay if it's just quickly on the phone versus like having to sit down and fill out a whole bunch of stuff, right?
Right, correct. And I think even the days of calling patients, patients don't answer their phone, but they will look at their text and say, oh, I have a bill. They have my card on file, or let me just enter this in. They're much more responsive to text, I feel like, these days. That's just how they operate. So using tools to send out a bulk text all at one time and using very little of our staff's time is essential, and has really increased the patient AR flow coming in with very little use of staff's time.
Certainly. Yeah, it's kind of weird when you get a phone call these days. It's like, why are you calling me? Why don't you just text?
Exactly.
Derek, let's throw it to you now for some specific examples you can share.
Yeah, sure. Well, what we see with our groups, and kind of like what they share with us, why they're using AirPay and what the benefits are, is mainly around efficiency. So we see this in a few different ways. A lot of groups can have these huge call centers. If you think about, contacting insurance carriers and retrieving eligibility and benefits data, there's only really one way to do it traditionally, and that was to just, get on the portals, make the phone calls, wait for the faxes. And so lots of DSOs that we work with have call centers, which with agents that are, supporting the practices and just kind of powering through these verifications all day, every day. Sometimes it's always, but it's essentially the same kind of thing, and it's quite expensive. There's lots of errors, and it's wildly inefficient, with where technology is today. And so we've been able to kind of like reduce the size of these call centers or eliminate them completely, and add a lot of savings back to the see this in terms of efficiency, just in the revenue cycle of less claim denials, cleaner claims, having to deal less with chasing around, AR either on the patient side or on the carrier side, by finding preventable issues before the visit and troubleshooting them, where the patient's names are spelled wrong. You've got the wrong insurance on file, like it's Delta of Ohio and you have Delta of Florida or whatever. Wrong genders, ID numbers are entered incorrectly, lots of kind of the data hygiene in the PMS. AirPay flags those issues prior to the visit, versus, seeing the patient and then getting the claim denied and, then needing to kind of figure this all out after the fact. And so we've got, just lots of really beautiful examples. We shared some case studies that'll be distributed with the resources after the webinar, of some specific groups that we've been able to do this with. And, we're just getting started, but we've got lots of really nice examples so far in a couple of years.
Yeah, thank you, Derek, and a good call out for the resources section too. Folks out there watching, you can check out. We've got a good bit of resources there for you to continue to engage with after our conversation today. But James, throwing it to you now for any additional specifics you want to share here.
Yeah, I think Elizabeth nailed it on the head, right? It's this idea of how do we make things easy without needing FTE involvement or reducing the friction on those FTE hours. So we did it. We were fortunate enough to be able to do it with Elizabeth and her team, but specifically we have a case study on our side of 30 plus location DSO who, when we initially partnered, they had a little bit over 8 million in aging AR and frankly a collections issue at point of care. And by leveraging things like card on file and improving the collections at point of care, we were able to kind of stop the bleeding from that perspective. And then with tools like bulk text to pay and some of those other efficiencies that we can deliver, we're able to take that outstanding AR and drop it down to 3 million in a little bit over a year. So just talking to, again, how do we allow smart automation to meet patients where they're at? Because every patient is going to engage or desire to pay in a specific way, whether it's via text. Some still like to go through online instances, and others still like to see that physical statement. And one of our core competencies is wherever we need to meet you and your patients at, that's our goal. Is we are in the business of collecting funds and collecting money, and however we can deploy that on your behalf is how we want to do so. So just an example of kind of meeting patients where they're at to dramatically reduce or drive down some aging AR for a client.
I would just add that this, for the DSOs listening, this is very, it can be very challenging because team members' adaptability to change is probably one of the biggest roadblocks that we hit when we're working with staff and team members, right? They've done things one way for 20 years. Things have been done a certain way, and they're very used to the way things are done. And I think just finding ways, whether to incentivize team members to just give it a shot, is something that we all have to get on board with as well. So I don't want to sit here and act like it's just easy to implement all of these new vendor products that really allow us to scale our team, right? I mean, if we're not chasing insurance AR or patient AR, we can really fight those real true denials, and we can fill those schedules for cancellations. We can do things that will also drive the revenue aside from this. But I think, we're all met with a lot of folks that sit in seats that really are not adaptable to change. And I think that's something that we really have to focus in on, is finding a way to motivate folks to really come alongside us and get updated to 2025, right? And the new things that are out there that will make their jobs easier. And let's really try to work smarter, not harder.
Follow up for you there, Elizabeth, thinking about that, because I think it's a very important point. What has been effective? Obviously, there's some folks are, as you mentioned, very, I guess, allergic to change or very hesitant to want to change at all. But for the folks that you can move along, that you have moved along, what's been effective at sort of generating buy-in? Is it that do they need to see the results first? Is it about like really sort of thinking through, having this, talk about this through the lens of the patient experience? What's been most effective?
Just letting our teams know that we're really here for the patient, right? And using tools to make it easier for the patient to get an accurate treatment estimate or to collect from them and make that experience ease. Just going from the patient experience, really, our offices, a lot of them are in really rural areas, and the patients are like family to them. Maybe they go to church with them, or they live in the same neighborhood as them. It's a more close knit, and I think they're really hold on to that patient relationship. So I feel like for them, just saying, this will increase our patient experience. We want to do this for the patient. That's really what hits home. I would love to tell you that I have secrets in my back pocket. This is probably the most challenging thing that I face, honestly. It's not dealing with payers. It's not the relationships with the vendors. It's really getting our teams to adapt to the technologies that are out there that will make their job easier. It's just different. And when you've done something the same way for 20 years or 15 years or even 10 years, that's what you know, and you come in and you just want to do what you know, and changing that up is hard. So we really challenge them just for 1 month. Use AirPay for 1 month. And if after 1 month, after I can log in and see that you're using it, so if after 1 month you're not satisfied, then we'll cancel it for you. And guess what? It never happens. Like they don't. When they buy into it and they use it, and you give them about a week, 10, 14 days, they really buy in and they're like, wow, this is so much easier. I've got all this time to do all the things that we've never done. Then their revenue is increasing by, using Rectangle's products and bulk text pay. We're not licking envelopes and sticking stamps on things. We're able to really do things to drive revenue. And then the team, the provider is happier, right? Because we're increasing our revenue, everyone's happier. And so the team really gets motivated. So once you start seeing the change come in and the revenue increase, you can get a lot of buy-in from the offices. But it's definitely the biggest challenge in my seat today is just adapting to change.
Yeah, I appreciate you calling that out, Elizabeth, and sort of your experience when folks do eventually use the technology. They realize, again, like I don't want to lick stamps all day or
right.
pound patients over the phone. Like, no, this makes sense. Derek, I want to come to you now because you sort of highlighted earlier the relationship here between the patient financial experience and the clinical experience. And of course, DSOs have to balance both, right? They have to be able to execute on both. So what, I guess, advice, Derek, would you have for folks out there watching who are trying to balance financial tasks with patient care priorities? What advice would you give them?
Yeah, sure. So again, we're very fortunate to work with lots of different groups across the country, and some are big, some are smaller. They're on all different practice management systems. They have all different ways that they do things. But I'd say two big kind of buckets I would put them in are centralized and decentralized. There's DSOs and DPOs and different labels. But lots of just individual dental practices, like the practice that I used to practice in, don't have a support staff. They don't have like a centralized RCM team that's supporting them. And therefore, they're doing all those rev cycle functions and taking care of the patients. And very often, it's not different people. There's not like a team in the front and a team in the back, like in a restaurant or whatever. In lots of offices, it's just the people at the front desk are talking to the patients, and in the other ear, they have the phone and they're on hold with a payer, discussing a claim or getting an insurance verification. And so, I'd say there's, for those types of practices, it's really essential to adopt tools and get some help. It's a really terrible experience to be in a dental practice and talking to somebody that has a phone glued to their ear. And I don't think that's why the person working in the dental practice really kind of like what they envisioned when they thought about themselves working in a dental office and helping patients and trying to delight them and show them a really positive experience. We see it also, just to touch on Elizabeth's point, with a lot of the DPOs or some of the more decentralized groups, that don't change the practice management system of offices that they partner with, and are less prescriptive about what those practices do, trying to offer services to those practices, whether it's verification or assistance with other rev cycle functions. And I think that's a really important endeavor or at least goal, to try to develop some of those services. The practices really want it. Like, despite I totally get this might be getting too into the weeds, but like the different models for DSOs. And being, again, less prescriptive to practices that you partner with. But a lot of there's not really, I'd say, folks that work at these practices that really want to hang on to their insurance verification. Like the way the doctor might want to hang on to clinical autonomy, right? There's probably not the same sentiment at the front desk in terms of hanging on to doing a lot of this just monotonous and labor intensive work. So, again, I think that just having that kind of that understanding of what type of organization you're running, but also having an understanding of like what's out there and what could make either your practices life easier, or the folks that work in your practices life easier, or just all of your practices if you're multi-location. There are more tools out there than there used to be, and they can really move the needle.
Yeah, and to your point, Derek, you're not going to get a lot of people I would imagine, at front desk saying, well, no, I like having a phone in one ear and trying to educate a patient in person. I don't think they're going to really push back too much on that. James,
or calling patients for outstanding balances or licking envelopes.
Yes.
Right. There's a lot of versions of that.
Certainly. James, coming to you now, what would you say here in terms of advice you would give to folks out there trying to balance financial tasks with patient care priorities?
Yeah, so I think every group is going to have their structure, their setup, their PPM systems that they work with. And when thinking about layering on some of these technologies, to Elizabeth's point, it is not sometimes the most enjoyable experience from the perception side of the world, at least. And when we think about how we deploy technology at scale, historically in the space, really decisions were made on, do we consolidate from a corporate perspective, which impacts the trickle-down impact at the practice level and feeling like the practice limits their autonomy, or do we give practice autonomy at corporate level, having to kind of consolidate and aggregate data on the back end? And one of the unique things that Rectangle has allowed for is we can configure and customize an experience at the clinic level to give them more autonomy while still managing and having that control for the corporate entity to report, make decisions, and ultimately scale the business. So it's really kind of looking at three things. It's one, how do we meet patients again where they're at, giving those patients optionalities while allowing the staff members to engage or receive those things, while having smart automation get them back to, let's say, 10 different PM systems in some cases across the portfolio, but then ultimately getting back to the RCM team that they can report, and the CFO who might be able to make a decision on how do we do those things. And if we can effectively manage those three boxes, we're giving that front staff member back time to have that engaging conversation with that patient as they walk in. We're giving the support staff more time to not be thinking about compliance aspects or some other things that always one of the 10 hats that an office manager may wear. Our goal is just to take a few of those hats off of them through leveraging that smart technology.
Yeah, I appreciate that, James. Elizabeth, anything to add here in terms of advice?
I just think to be really careful in practices with timing, right? Find out what your biggest pain point is, or what is causing your revenue maybe to not come in at the same speed, and really just start there, not implementing everything all at once, right? We don't want to overwhelm people. So just choosing your tech stack, what's best for your office, and then starting with just one. And really, once they adopt the use of automation, the next one won't be as hard. The first one may be challenging, but just starting somewhere and giving one of them an opportunity to really scale your admin staff. And again, we're not talking about eliminating people, right? We have other tasks like greeting the patient well, like Derek said, not greeting them, like, or doing a treatment plan, but not wanting to hang up the phone with the payer because you've been on hold for 45 minutes. You really want to be able to have a great patient experience, all going back to the patient and making sure that they're taken care of and they really feel like they're willing to return to your practice because they really were treated with such great care.
Yeah, they want to be able to delight patients. There's other things to focus on that can be highly motivating. Thank you so much. James, I want to come back to you because I think I've made you go last most of the time for most of these questions. So we'll have you go first for this one. But I want to get to some more. I think we've heard some great examples already, but I want to sort of challenge each of you to, I guess, tell a story about how a DSO has overcome revenue challenges and what it's meant. Can you share a real world example, James, and what kind of lessons folks watching can take away from that example?
Yeah, so I think I'm going to look at this almost in a different lens. And again, kind of thinking back over the last 5 years, when everything materialized 5 years ago, nearly all calls coming to us were about digitizing those efforts. 4 years ago, it was about figuring out how do we leverage card on file to make a convenient experience for the patient. 3 years ago was furthering expanding the options to our patients. 2 years ago was sending mass communications in the form of bulk text to pay. The last year's really been focused on this idea of straight through processing or speeding up the claims process. And why I reference all those things is there's always something new. There's always something that's coming down the way that's designed to enhance, automate, speed up, provide those value points. And as a technology partner and somebody who's sitting in that seat, I see those values and I see those opportunity sets. And I think really that story, again, from start to finish of a lot of these moving pieces to fill that entire process is all critical. And one thing that Elizabeth just said is a perfect way. The old adage that the easiest way to eat an elephant is to take one bite at a time. And it's that concept of this RCM. It feels robust and massive and huge, and it is. But if you don't take meaningful steps to get toward kind of this idealistic state, we're never going to be able to get there. And I tell that long monologue, I think, to almost set Elizabeth up to be able to answer this question. And from the perspective of, as a vendor in the space, I can share all these amazing things that our technology is able to do. But Elizabeth lives it and breathes it with her and her team all day. So Elizabeth, I actually, even though you have been the one who's answered a lot of these questions to start, I'd maybe love to kick it back to you just because you are living it on a day-to-day basis. And I'm more just talking about it, if you will.
From the use of technology, we've seen our day sale outstanding or collection days decrease from 28 to 14 days in some of our offices that had the largest problem, and all the way down into the single or near single digits for offices that have outstanding carrier AR or insurance AR. But we've also seen our patient collections for those that have adopted the software and use it well significantly. So we've seen patient AR, which I'm going to be honest with you, was a problem for us. Our teams had a really hard time discussing balances with patients. They didn't want to have those conversations. So being able to text patients in bulk and not have to have that conversation with them that can ultimately sometimes lead to confrontation was a way that we could improve our patient experience, make life a little easier on our staff, and drive our revenue. And then we use insurance verification tools now, and we're able to really target what that, we call it OTC sales or over-the-counter sales, like today, what the patient owes, and really trying to collect that the day they come in. We can't do that without tools like AirPay that really give us a great breakdown and let us know what the patient's responsibility will be. So for us, it's kind of full circle. We also use a claims management tool that allows us to identify problems and issues very fast. It gives us some denial, like some tricks on how to resubmit the claim, right? If we have an inexperienced person working that is a new team member, it might just say, if you'll add a PA, resubmit, this claim will be paid, right? It's a lot easier than her trying to figure out or getting someone else to assist her. So we've really seen our collection days reduce significantly, our patient AR reduce significantly, and then our staff to really fill those schedules. That was one thing, we had holes in a schedule. Well, the staff was saying, well, what do you want me to do? I'm trying to collect the patient AR. I'm trying to chase the denials. The phone is ringing. The patients are standing in front of me. We're short staffed. I'm 2 people. Tell me what you want me to do. So the use of these tools has been, greatly beneficial to the offices to really say, okay, now we're letting the technology do a lot of the work, and we can really focus on the things that we actually need a person to do. And it's been significant for us. I mean, we've had some challenges with people adopting the technology, but once they do and they see the results, it really speaks for itself. And we find that managers or admin teams, they communicate with each other and they start telling each other. And then I no longer have to sell them, I should say, but I don't want to tell people you should really use this. They're telling each other. And then before long, everybody wants in on it. Everybody wants to work smarter. So we've seen significant results. And I think we're just going to keep plowing away and trying to make sure we have the perfect tech stack to drive profitability, but also We want to keep the patient's experience in mind. So we don't want to go overboard, right, and ruin the patient experience either. I think there's a pretty um, unique window that you can be in, and you can say, okay, this is where we want to be. And each DSO is going to be different. We're decentralized, so we have a lot of patient contact. And in our offices, like Derek said, they wear many hats. They're doing all the things at one time. So I think it's imperative to get some of these tools in place so that we can really focus on the things that are going to drive the revenue the most.
Yeah, I really appreciate, Elizabeth, you sort of giving us an inside look at your experience. And it sounds like while you have encountered some change management hesitancy, we'll say, there's also been, some really strong results to point to. And it seems like it's something that eventually, over time, once people start using the tech, it becomes less of an issue. So I appreciate you sharing your experience. I'm going to move here before we get to the audience Q&A. And folks, as a reminder, you can enter questions for panelists into the Q&A box there on your screen. I want to get to a final question here about what's to come, what folks can expect. What trends should DSO leaders be looking out for, and how can they prepare? Derek, I'm going to throw this one to you first. I think you sit in an interesting position to give you an overview of what you're seeing out there and what you think DSO leaders should be paying attention to.
Yeah, I kind of mentioned this before, but there is a trend, I would say, and a sentiment just among DSOs and the payers to just make things easier. Payers want to make things easier. We're working, AirPay is working with quite a few payers at this point. We're fortunate to have lots of big clients. They introduce us to the payers. I think 3 years ago, I couldn't visualize that. I'm a dentist, and so I always had this perception of the dental insurance carriers. And in my conversations with them over the past couple of years, I'm realizing that I kind of misunderstood where they were coming from. And they really are genuinely interested, at least the ones that we're having conversations with, to make things easier for practices, for the providers, to ultimately provide a better experience for the patients, to remove ambiguity and friction, to add clarity to the process from verification to paying out the practice. So that's something that we're seeing over and over again. Like kind of when it rains, it pours. We are fortunate now to just be working with lots of payers, and we're seeing the same thing kind of across the board with them. And that's obviously an amazing trend, and something that'll have lots of effects, I think, across the board for patients, for practices, for software vendors and third parties, but all positive.
Thank you for that rundown, Derek. James, what would you add to the list, or what would you reemphasize based on what Derek shared?
Yeah, I think when we think about trends, it goes back to, again, the two words I'd probably use more than anything, and that's speed and automation. And when we think about that technology that I referenced, straight-through processing, it's this idea of automating claims from those payers to speed up that access to cash. And I think our view of that,
Rectangle's view of that piece, is really the last domino to have true control of our RCM process from start to finish. Again, when we think about everything moving together, if we don't have a tight grasp on kind of that access to cash when that payer pays that claim, being able to view and review that EOB post-adjudication, all of these moving pieces allow us to have that front door through kind of that backdoor experience for everything along the way. So I think that is what I see as probably the biggest trend, is just how do we automate a lot of those claims payments, and how do we do it faster than what we're doing today to give our teams more time and access to go chase after any of that additional information.
Excellent. Elizabeth, anything to add here before we take some audience questions?
I would just say scalability, just being able to find, again, the perfect combination for your group, and really focusing on what's your top priority, where is your pain point, and where are you going to start. I think for so many DSOs that reach out and ask about what we're using or what we're doing, whether we're sitting on a monthly RCM call with other partners or we're at the NADP or wherever we are with industry folks. Everyone's asking, what are you doing? And when you do that and folks aren't using any automation, I would just encourage them, just take one step, just see what it could do for you and your team. I think it's going to be a game changer in the industry, and finding out what's best for your group is just, it's going to make huge strides so we can really hire the right people, have the right people in the right seats, and then just drive our profitability. We know the payers are not going to be apt to increase fees as quickly as they may have before. So we really have to find a way to drive that revenue. The providers can only produce so much. So if we can collect faster and it costs less dollars to chase that revenue down, then we've really benefited the practice just from the rev cycle.
Well, panelists, it's been a pleasure walking through this conversation with you all. Appreciate you taking the time and appreciate your contributions. Let's now move to the audience Q&A portion of this webinar. And as a reminder for folks, we appreciate you all taking a second to fill out the survey that you should be able to see on the right-hand side of your screen. Really, truly appreciate your feedback. All right, so let's get into it. The first question we'll grab here, relevant to the conversation. In today's ecosystem, the attendee asks, what technologies do you believe will stand the test of time? James, maybe you can take this one for us.
Yeah, absolutely. I think this is one of those questions that, as we referenced, there's more technologies than maybe there's ever been in the past. And those organizations who would rather partner and deliver that exceptional experience in working with somebody like an AirPay or others, it's this idea that we're kind of layering on technologies because no single platform does everything exceptionally well. So when we start to tack these things on, how do we ensure that there's interoperability between these tech stacks as we deploy them simultaneously? And I think that the technologies that are going to ultimately win in this ecosystem are those that are willing to share data and provide the best experience for our mutual clients.
Excellent. Derek, Elizabeth, anything to add on that one?
I disagree with what he said, though. We're looking for folks that can talk to each other, right? So that their softwares can benefit us by speaking to one another, or softwares that do more than one thing. I think those are the ones that are really going to succeed, right? We're going to need claims management tools. We're going to need insurance verification, and we're going to need payment processing tools like Rectangle has. So those are things we have to have, and the ones that can speak best to the payer, to the patient, and then back to the practice and each other are the ones that I think are going to be the most successful.
Yeah, I think it's well said. When we first got started with AirPay doing insurance verification, none of the practice management systems would work with us because we were doing something that technically they did already. And fast forward, we now have official partnerships with all the major practice management systems. And again, that's, I believe that, not every system can do everything perfectly or do it the best. You kind of got to pick your lane. And so the systems that play nicely with others and integrate and don't try to kind of take the walled garden approach will stand the test of time.
Yeah, I think those comments too fit into tie in nicely to sort of the next audience question we're going to take, which is about insurance verification. So Derek, I'll throw it to you, but the attendee asks, regarding insurance verification, as a dental billing company, I took demos from various systems and learned that most don't have an option to verify secondary and tertiary insurances. How can we automate this? Please give examples.
Cool. Good question. So in our system, I can answer for AirPay, we automatically pull from the practice management system, again, regardless of the system, primary and secondary insurance, and will automatically verify primary and secondary insurance ahead of the appointment. We don't really get asked much about tertiary, that it's only come up maybe once or twice in a couple of years. So it's certainly something that we're capable of doing. But today, AirPay automatically verifies all primary and secondary insurance. So in the dashboard, you'll see kind of, each patient, primary, and if they're secondary insurance, the insurance status of each. And you can kind of click in and see the details of the primary insurance and the secondary insurance.
Excellent. Appreciate you.
That's an easy one.
Appreciate you giving the clarity there and talking through that for our attendees. The next question, we've got time for maybe one or two more, but the next one we'll grab. The attendee asked, dental seems to be taking a back seat in healthcare to med surg, primary care, et cetera. How are you driving forward the importance of dental utilization for overall health while improving the relatively smaller portion of the healthcare dollar? Elizabeth, you want to maybe try to chime in here first, and then welcome any comments from James or Derek as well.
So I spent about 10 of my years on the medical side, and they are about 10 years ahead of on the dental side. But I would think, I also think that dental insurance billing is a lot easier than medical billing, right? There aren't CPT codes, there aren't thousands and thousands of them, and we don't have to use diagnosis codes. And I mean, the denial rate, although in dentistry can be high, I do think it's a simpler world that we live in. However, I do feel like the use of tools in dentistry in the last 2 to 3 years has been significant. And I feel like the denial rates for claims and processing those claims can go down significantly if you're checking those and really get your collection days down. I would say on the medical side, I don't find really some of the tools that we have here in dentistry. I'm surprised, and I've said to our vendor partners, like, why aren't you guys on the medical side? You could really drive those things. So there's a little bit of give and take. It's a lot more complex on that side of the playing field. So, I think although they're both in healthcare, they're very different, and the worlds that they live in are also very different. Their compliance and regulatory components are also very different. So I do think dentistry's come in the last 2 to 3 years significantly further and at a rapid scale. And I do think things are changing rapidly. Even since Change Healthcare went down, I've seen a lot of folks, as they're upping their security, they're also making significant changes to their portal, both good and bad.
Excellent. Well, thank you for grabbing that one, Elizabeth. Let's do one more. I want to make sure we get to this one because James, at some point in our talk, the audio was coming through a little low, a little fuzzy for you, but want to make sure you get some clarity to the attendee who asks. You mentioned straight through processing. The attendee wants some clarity there on, is that for payers or patient payments? Just ask sort of straightforwardly here to dive into that further.
Yeah, processing, directly automating the payments from the payers. And really the technology, though, is not only to get you paid faster, but give you access to critical information to go chase any of those outstanding patient payments. So it's really thinking about a holistic idea, again, of increasing speed around that payment, but then taking that one step further. And if there is an outstanding charge remaining after insurance adjudicates, how do we go and capture that $100, that $200 in the most convenient way possible? Thinking, again, to what Elizabeth said, at grabbing that and any other outstanding balance in a bulk text, sending that file out and having our patients self-manage and self-ultimately pay for those outstanding balances. So to answer the question, straight-through processing is for payers, the payer payments.
The payer payments, and then you're able to look at sort of what's left with the patients and act on that, correct?
Exactly.
Excellent. I'm glad we got to cover that. And again, if we weren't able to get to one of your questions you asked today, someone will follow up with you after this webinar and be in touch there. One final thank you here to Derek, Elizabeth, and James for being such excellent panelists and taking some audience questions as well. Thank you to Rectangle Health for helping Becker's put this together. Truly appreciate your partnership. To learn more, as I mentioned previously, we've got a bunch of additional resources in the webinar console there. Please do check those out. Thank you so much for joining us today. We hope you have a wonderful rest of your day.
Thank you.